For over 30 years, my world has been defined by the steady rhythm of a beating heart. As a cardiac surgeon, I've held that life force in my hands more times than I can count. But I've come to realize the greatest threats to your heart don't always start with a dramatic emergency. They often begin with a quiet routine, a pill you take every single morning. Countless seniors, people in their 60s, 70s, and beyond, walk into my clinic. They're worried. They describe a shortness of breath they blame on age, a chest flutter they dismiss as anxiety, or a crushing fatigue that feels like the new normal. They've tried changing their diet. They've tried managing stress, yet the feeling persists. And so I ask them a question that often stops them in their tracks. Let's talk about the prescriptions you trust the most. What we're now discovering, and what your doctor may not have warned you about, is that some of America's most common, everyday medications can act like silent saboteurs inside your body. They perform one job, like lowering pain or managing blood sugar, while quietly creating a much more dangerous problem for your heart. In this video, we are going to expose these hidden risks. I will reveal the 7 types of pills that could be silently undermining your cardiovascular health. The number 1 medication on this list is taken by millions, and its effects can be devastating over time. This isn't about creating fear. It's about giving you the knowledge to take back control. You have a right to understand what you're putting into your body. So let's get started. All right, let's begin our countdown with pill number 7. You'll find this one in almost every home in America. Pill 7, NSAIDs, the common painkiller. NSAID stands for non-steroidal anti-inflammatory drug. That's a mouthful, but you know them by their brand names: Advil, Motrin, Aleve. If you're over 60, chances are you've reached for one of these for the familiar aches of arthritis, a stiff back in the morning, or a nagging joint pain that just won't quit. They seem harmless. You can buy them anywhere. But here's the truth: when taken day after day, these common painkillers can put your heart under serious, constant strain. Here's how. NSAIDs work by blocking certain enzymes in your body, but in doing so, they can cause your body to hold onto more salt and water. Think of it like adding more water to a water balloon that's already full. The pressure builds. This extra fluid forces your heart to work harder, pumping against increased pressure in your blood vessels. Your blood pressure starts to creep up. For an aging heart, this isn't a small thing. This quiet, internal pressure can be enough to trigger heart failure or push a stable heart rhythm into a dangerous, irregular beat known as atrial fibrillation. Over time, the damage gets worse. These pills can constrict the blood vessels leading to your kidneys, reducing their ability to filter your blood effectively. When your kidneys struggle, your heart has to pick up the slack. It's a vicious cycle. If you're already taking medication for high blood pressure, NSAIDs can actually interfere with it, making your prescribed treatment less effective. You think you're protected, but this over-the-counter pill is silently working against your doctor's plan. The pain relief you feel is immediate. The damage to your heart is gradual. That's why I always tell my patients pain relief should never come at the cost of your heart. If you need something for more than a few days, you must talk to your doctor about safer, heart-friendly alternatives. There are other ways to manage your pain. Now let's move on to pill number 6. This one is prescribed to millions of seniors managing a very common condition. Pill 6, certain diabetes drugs, the thiazolidinedians, TZDs. If you're one of the millions of Americans managing type 2 diabetes, this is critical information. There's a class of drugs known as thiazolidinedians or TZDs. The most common names you might see are pioglitazone, Actos, or rosiglitazone, Avandia. Their job is to help control your blood sugar by making your body's cells more sensitive to insulin. And they do that job well. But they come with a dangerous side effect that's directly linked to the heart. Just like NSAIDs, these medications can cause your body to retain fluid. A lot of it. This fluid buildup often shows up as swelling in the legs and ankles. It can make you feel bloated and sluggish. But the real danger is the invisible fluid, the fluid that accumulates around your heart and lungs. This puts immense pressure on your cardiovascular system, forcing your heart to pump harder and harder just to circulate blood. For a senior who may already have some level of heart weakness, this can be the tipping point into congestive heart failure. What's truly deceptive is that the early symptoms of heart failure, like fatigue or shortness of breath, are often mistaken by patients as just symptoms of their diabetes or simply getting older. You might not connect the dots. The drug is masking the very damage it's causing. Seniors with diabetes are already at a much higher risk for heart disease. Adding a medication that directly strains the heart is like pouring gasoline on a smoldering fire. While some newer diabetes medications have been shown to protect the heart, this older class of drugs does the opposite. If you are on a TZD medication, especially if you've noticed any new swelling, tiredness, or difficulty breathing, you need to have a serious conversation with your doctor. Managing your blood sugar is vital, but it must not be done at the expense of your heart. Coming in at number 5 is a pill that millions of seniors turn to for a basic human need: a good night's sleep. Pill 5, certain sleeping pills, the sedative hypnotics. Insomnia and poor sleep are epidemics among older adults, and the promise of a pill that delivers 8 hours of uninterrupted rest can feel like a miracle. I'm talking about sedative hypnotic medications, drugs like zolpidem, Ambien, azopiclones, Lunesta, or older benzodiazepines like diazepam, Valium. They work by slowing down your brain activity. They depress your central nervous system. And that's the problem. Your central nervous system controls everything, including your heart rate and your breathing. When you take one of these pills, your heart rate slows and your blood pressure drops. But more importantly, your respiratory drive, the automatic signal that tells you to breathe, is suppressed. During sleep, this can lead to a dangerous condition called sleep apnea, or it can make existing apnea much, much worse. Sleep apnea is when you stop breathing for short periods throughout the night. Each time this happens, the oxygen level in your blood plummets. Your body panics. It releases a surge of stress hormones like adrenaline to jolt you back to breathing. This nightly cycle of oxygen deprivation and adrenaline surges is incredibly violent for your heart. It can trigger severe high blood pressure, strokes, and life-threatening arrhythmias. You go to sleep seeking rest, but your heart is going to war all night long. Furthermore, these sedatives can have a hangover effect, causing dizziness, confusion, and impaired balance the next day. For seniors, this dramatically increases the risk of falls, which can lead to broken hips and a cascade of other health disasters. Relying on these pills is a dangerous bargain. You get the illusion of sleep while your heart and brain are slowly being starved of oxygen. There are far safer, non-pharmaceutical ways to improve your sleep hygiene. Please explore those first. Long-term use of these sedatives is a risk that is simply not worth the reward. Next up is pill number 4. This is an older class of medication, but it's still being prescribed for mood and nerve pain with significant risks for an aging heart. Pill 4, tricyclic antidepressants, TCAs. Tricyclic antidepressants are among the earliest developed treatments for depression. You might know them by names like amitriptyline, nortriptyline, or imipramine. While they've largely been replaced by newer, safer SSRIs like Prozac or Zoloft, these older drugs are still used, often for conditions like chronic nerve pain, fibromyalgia, or migraines. The problem is, their chemical structure has a profound effect on the heart's electrical system. Think of your heartbeat as being controlled by a precise electrical circuit. TCAs can interfere with that circuit. They can slow down the electrical conduction, leading to a dangerous condition called heart block, where the signal from the heart's upper chambers to its lower chambers is delayed or completely blocked. This can cause a dangerously slow heart rate, dizziness, and fainting spells. They can also directly trigger arrhythmias, making the heart beat erratically and inefficiently. For anyone with a pre-existing heart condition, this is playing with fire. Even in people with healthy hearts, these drugs can cause something called orthostatic hypotension. This means when you stand up from sitting or lying down, your blood pressure suddenly drops, making you feel lightheaded and dramatically increasing your risk of a fall. The newer generation of antidepressants is much kinder to the heart. There is rarely a good reason for a senior, especially one with any cardiac risk, to be on one of these older tricyclic medications today. If you are taking a TCA for pain or any other reason, ask your doctor if there is a modern alternative that doesn't carry these cardiac risks. Your mental health and pain management are important, but they should not jeopardize your heart. Pill 4 tricyclic antidepressants, a TCAs, a VLK, a shot of a prescription bottle with a name like amitriptyline, clearly visible. Tricyclic antidepressants are among the earliest developed treatments for depression. You might know them by names like amitriptyline, nortriptyline, or imipramine. While they've largely been replaced by newer, safer SSRIs like Prozac or Zoloft, these older drugs are still used, often for conditions like chronic nerve pain, fibromyalgia, or migraines. The problem is, their chemical structure has a profound effect on the heart's electrical system. Think of your heartbeat as being controlled by a precise electrical circuit. TCAs can interfere with that circuit. They can slow down the electrical conduction, leading to a dangerous condition called heart block, where the signal from the heart's upper chambers to its lower chambers is delayed or completely blocked. This can cause a dangerously slow heart rate, dizziness, and fainting spells. They can also directly trigger arrhythmias, making the heart beat erratically and inefficiently. For anyone with a pre-existing heart condition, this is playing with fire. Even in people with healthy hearts, these drugs can cause something called orthostatic hypotension. This means when you stand up from sitting or lying down, your blood pressure suddenly drops, making you feel lightheaded and dramatically increasing your risk of a fall. The newer generation of antidepressants is much kinder to the heart. There is rarely a good reason for a senior, especially one with any cardiac risk, to be on one of these older tricyclic medications today. If you are taking a TCA for pain or any other reason, ask your doctor if there is a modern alternative that doesn't carry these cardiac risks. Your mental health and pain management are important, but they should not jeopardize your heart. Pill 3 decongestants, pseudoephedrine and phenylephrine. When you have a stuffy nose from a cold or allergies, you want relief fast. And those behind the counter or on the shelf decongestants that contain pseudoephedrine or phenylephrine seem like the perfect solution. They work by narrowing the blood vessels in your nasal passages. This reduces swelling and helps you breathe easier. But here is the critical part. They don't just narrow the blood vessels in your nose, they narrow blood vessels throughout your entire body. This process, called vasoconstriction, forces your heart to pump much harder to push blood through these tightened vessels. The result, a sudden and significant spike in your blood pressure and heart rate. For a young, healthy person, this might just feel like a case of the jitters or a racing heart. But for a senior with even mild high blood pressure or undiagnosed coronary artery disease, this extra strain can be dangerous. It can trigger a heart attack, a stroke, or a severe arrhythmia. Many people think it's sold over the counter, it must be safe. This is a dangerous assumption. Age changes everything about how your body processes medication. A drug that was harmless for you at 40 can pose a major risk at 70. Always read the active ingredients on cold, flu, and allergy medicine. If you see pseudoephedrine or phenylephrine and you have any history of heart issues or high blood pressure, you must avoid it. Talk to your pharmacist about safer alternatives like saline nasal sprays or antihistamines to manage your symptoms without putting your heart in danger. Let's move on to pill number 2. This is a medication that millions of Americans take daily for digestive comfort, believing it's as safe as a vitamin. The research now tells us that's not true. Pill 2 proton pump inhibitors, PPIs, heartburn, acid reflux, GERD. These are incredibly common issues, and the go-to treatment for decades has been a class of drugs called proton pump inhibitors or PPIs. You know them as omeprazole, Prilosec, esomeprazole, Nexium, or pantoprazole, Protonix. They work by powerfully shutting down the acid producing pumps in your stomach, and for short-term relief they are effective. But people don't use them short-term. They stay on them for years, sometimes decades, thinking they are completely harmless. But a growing body of evidence shows that long-term use of PPIs can lead to serious cardiovascular problems. Here's the connection. First, by reducing stomach acid so drastically, PPIs interfere with your body's ability to absorb essential nutrients from your food, most critically, magnesium. Magnesium is an absolutely vital mineral for heart health. It maintains a steady heartbeat, regulates blood pressure, and supports muscle function. When your magnesium levels are chronically low, it can lead directly to dangerous arrhythmias, heart palpitations, and even cardiac arrest. Second, Recent research suggests that PPIs may damage the delicate lining of your blood vessels, known as the endothelium. A damaged endothelium can lead to inflammation, blood clots, and an increased risk of heart attack and stroke. The problem is that these pills are seen as a permanent solution when they should be a temporary fix. If you have persistent heartburn, the goal should be to work with your doctor to find the root cause. Whether it's diet stress or a physical issue, not to simply mask the symptom with a pill for the rest of your life. If you've been on a PPI for more than a few months, it's time to ask your doctor for a plan to reassess and hopefully de-prescribe. Your long-term heart health is far more important than short-term digestive comfort. And now it's time for pill number 1. The most dangerous pill on our list is not some rare, obscure drug. It is one of the most widely prescribed medications for seniors in the United States. It's designed to help the heart, but in the wrong context, it can be devastating. Pill 1, certain calcium channel blockers. Calcium channel blockers are a large class of medications prescribed to treat high blood pressure, chest pain, angina, and irregular heartbeats. They work by relaxing the blood vessels, making it easier for blood to flow. However, there is a specific subclass of these drugs, known as the non-dihydropyridine calcium channel blockers, that can be particularly risky for seniors. The two most common drugs in this group are verapamil and diltiazem. While they do relax blood vessels, their primary effect is to slow down the heart rate and reduce the force of the heart's contractions. Now, for some conditions, this is exactly what's needed. But for a senior whose heart muscle may already be weakened by age, or who might have a slow heart rate to begin with, a condition called bradycardia, these drugs can be disastrous. They can slow the heart down too much. This can lead to a dangerously low heart rate, causing severe fatigue, extreme dizziness, fainting, and an overall lack of blood flow to the brain and other vital organs. Furthermore, they can significantly worsen heart failure. By reducing the heart's pumping strength, they can cause fluid to back up into the lungs, leading to shortness of breath and swelling in the legs. The greatest danger is that these side effects, fatigue, dizziness, shortness of breath, are often blamed on old age, rather than the medication itself. The patient feels unwell, but they assume it's just a part of getting older, never realizing it's the pill they take every day that's making them feel so weak. These are powerful, important medications, but they require careful selection and very close monitoring. They are not the right choice for every patient with high blood pressure. If you are taking verapamil or diltiazem, and you are experiencing profound fatigue, lightheadedness, or a heart rate that feels consistently slow, you must bring this to your doctor's attention immediately. Never stop a heart medication on your own, but always be an advocate for your own health. Ask if it's the safest and most appropriate choice for your specific condition. Your life may depend on it. So, there you have it, 7 classes of common medications that could be silently placing your heart at risk. From the painkiller in your cabinet to the prescription you've taken for years, the threat is often hiding in plain sight. Now, I want to be perfectly clear. The purpose of this video is not to make you afraid of your medicine cabinet, it's to make you wise about it. As a heart surgeon, I have seen firsthand the incredible power of modern medicine to heal, but I've also seen the devastating consequences when those medicines are not properly monitored or when their side effects are ignored. Too often, symptoms like fatigue, dizziness, or swelling are dismissed as an inevitable part of aging. They are not. They can be whispers, your body's way of telling you that something is wrong, and it is crucial that we learn to listen. So here is your action plan. First, do not, under any circumstances, stop taking a prescribed medication on your own. That can be incredibly dangerous. Instead, take out a piece of paper and write down the names of the pills you take. If any of them were on this list, put a star next to them. Take that list to your next doctor's appointment and start a conversation. Ask the question, is this still the safest and best option for me? Use tools like the Senior Health Tracker app to show them your symptoms and blood pressure logs. Give them the full picture of your health. Knowledge is the most powerful tool you have. Your health is a partnership between you and your doctor, and you are the most important member of that team. If you found this information valuable and you believe in this mission of empowering seniors with life-saving knowledge, please do two things for me. First, click the subscribe button and turn on notifications. Our channel is dedicated to bringing you honest, no-nonsense health advice that is specifically for people over 60. Second, share this video. Send it to a friend, a parent, a sibling, anyone in your life who you care about. This information could truly make a difference. Thank you for your time and your trust. Take control, ask questions, and be your own best advocate. Stay safe and stay heart strong.